2-lane roads leading into the town of Snow Camp, North Carolina, are dotted with family farms and country churches. It's about as far removed from a bustling population center as you can imagine.
Hi!
How are you?
Okay, Leslie, how are you doing?
And that's precisely why nurse practitioner Leslie Sharp enjoys working here.
It has been one of the most rewarding jobs I've ever had.
Aside from one medical assistant and a little part-time help, Sharp's Sylvan Health Center is essentially the only healthcare provider for this entire community.
When we started, I was probably only seeing maybe 4 to 6 a day. I'm now seeing anywhere from 10 to 16 a day.
Her clinic is made up of some converted classrooms at Sylvan Elementary School.
This is our little storage room.
And is the result of a collaboration between Piedmont Health Services, the Alamance Burlington School System, and the UNC School of Nursing.
The patients I take care of are often quite complex, especially some of the ones who have not received health care for several years.
Sharp sees a broad mix of patients, students and teachers, community members, Medicare and Medicaid recipients, people with private insurance, and even some without any. The clinic is unique for the state of North Carolina, and in less than 2 years is already an overwhelming success. But it wouldn't be possible for many other nurse practitioners to even consider.
I'm very fortunate that in working with Piedmont Health Services, I have access to a physician to be my supervising physician.
State regulations require nurse practitioners to sign a contract with a physician who agrees to supervise their practice. That physician doesn't have to see patients or even step foot in the building. It's often a costly burden and a regulation that does little to impact patient care.
Because of an agreement that's based on 2 individuals and not necessarily based on the education and training of the nurse practitioner.
For years, healthcare experts around the country have touted the idea of allowing nurse practitioners and other advanced practice nurses to work to the full scope of their training and education without the red tape of physician supervision. Even the Institute of Medicine has advocated for modernizing these regulations.
With the requirement of supervising physicians, it limits a lot of nurse practitioners from being innovative and coming up with these solutions to the healthcare issues that are out there.
Opponents of this idea have typically relied on one argument to support physician supervision: patient safety. However, there is simply no evidence that physician-led primary care practices are any safer than those run by advanced practice nurses.
They've not been able to prove it, and even in some of their own publications, the physician groups have lamented the fact that there's a paucity of data.
Much like with any primary care physician, advanced practice nurses inherently refer patients to a specialist if they find something beyond their scope of practice. Sharp has already been doing this routinely at Sylvan Health Center.
She'll hop right on something if she thinks I need to see a specialist or I need to go further with another test or anything like that. She's just incredible.
The need for primary health care providers is getting bigger every year. Nursing is the most trusted profession in the United States for a reason, and Sharp and other nurses say North Carolina's laws should reflect that trust that patients put in nurses every day. Unfortunately, the great example being set in Snow Camp is the exception, not the rule.
Bye. Bye. See you later.
But by modernizing regulations, lawmakers have a chance to give this opportunity to other communities across the state.